The circle of Willis is formed by the anastomoses of the two internal carotid arteries and the two vertebral arteries at the base of the brain. To illustrate how the circle of Willis is formed, we will first break it down into its individual arteries. We'll begin with the anterior communicating artery and the anterior cerebral arteries. The anterior communicating artery is a short anastomoses between the two anterior cerebral arteries, here demonstrated by Kristen Stewart and full company. The anterior cerebral artery supplies the medial surface of the brain, hypothalamus, optic chiasm, and a portion of the motor strip, specific to the feet. The common carotid runs up along the neck and bifurcates into the external and internal carotid arteries. The internal carotid then further divides into the anterior and middle cerebral arteries. This bifurcation is here demonstrated by a conga line. The posterior communicating artery connects the posterior cerebral artery and the middle cerebral artery, here shown by the line of three people connecting the two outward flowing lines. The high fives indicate a connection. The vertebral arteries originate from the subclavian line and travel up through the transverse foramen of the spinal column. The vertebral arteries then converge to form the basilar artery. This is thus demonstrated by the two rows of people joining into one with linked arms. The basilar artery then terminates into the posterior cerebral artery. The complete circle of Willis is here represented by the full company. The seated and kneeling individuals represent the arteries. Abby and Michelle, center stage, represent the internal carotid arteries. The standing dancers are here personifying the communicating arteries, and the scuttling figures with ribbons represent the blood flow through said arteries. For our grand finale, we here present what happens when a blockage occurs. Ray, clad in scarlet, embodies the occlusion of one of the anterior cerebral arteries. The circle of Willis then compensates for this blockage by redirecting the blood in an alternate route.